Welcome back to For the Health of It. Getting to know all of the people that are going to be part of this great health segment. And in the studio with us next, we have Nick. You're going to have to say your last name for me. Is it Dobrzeski?
Is Dubjaletsky.
Dubjaletsky. And I was telling Jim, who's sitting in the studio with me, I'm like, oh, I've got his card. I'm going to blow this, though. It's just not going to happen. So I'm going to let him do it. But he's with Daymarck here in downtown Bismarck, close to the URL radio studios. So tell us a little bit about what you guys do, Nick, at Daymarck.
Well, Stacy, we provide medical coding for home health agencies across the country. And this is kind of a fairly new concept within our industry. And so we're hitting extreme amount of growth right now. And so it's keeping us very busy. But we, like we talked before, we tailor just to the home health industry, and that's really where my background is, and I've been working in that industry for about probably the last 11, 12 years now.
But you weren't always just working with medical coding, were you? You actually have like a medical background as well.
Correct. Actually, I'm a registered nurse. Right after college, went into the Army, was an Army nurse for about 4 years, did some time overseas, and then came back and started working for my stepmother in Ohio, who has a home health agency, and so I got kind of wrapped into home health.
So then how did you get wrapped into coding?
Well, over the years, I was kind of moving around in different administrative positions, we started seeing the increased need for medical coding. And there were some changes that occurred back in 2008 that allowed for our business model to start off. But then there's also some big needs coming up in the future that's even outside of the Healthcare Reform Act, that was some changes on the medical codes. And so we have a lot of agencies right now that, and not just agencies, but there's hospitals, and this affects physician offices across the country that are faced by this challenge. And so we basically come up with a business model to help support these agencies during this time of need.
Now, do you find that it's even trickier trying to code for home health care?
It is. It's a little bit different the way it's done. Within the industry, we code at different time points, and unlike a physician's office where they just code, you go in there for a runny nose and they say, okay, upper respiratory infection, and here's a code for that. Or if you go into a hospital, they may do 5 or 6 codes, but pretty much what was related to that hospitalization, we have to code everything that's wrong with the patient. And so that becomes a lot more trickier and a lot more comprehensive.
Yeah.
And typically what we're doing is we're coding up front, so we're saying this is what's wrong with the patient, but sometimes you don't get to know some of that stuff until, third or fourth visit. So we try to get a lot of information up front and from different sources. And so it's done a little bit differently. One of our big challenges is trying to find coders across the country. Within the state of North Dakota here, there's only 2 registered home care certified coders. And I think I just found out last week in Minnesota there's only 17. Now you go down to like Florida or some other states, there's like a couple hundred coders down there. And so one of our challenges is we get a lot of people from coding schools and stuff, and then they come to us thinking that they can do, just jump into the job, and so, but then we have to do some retraining. But we have a lot of projects and that are coming up to kind of help bridge some of that gap of that knowledge base. So as we grow, that we can have, be able to hire more people across, locally and across the country.
So now I'm sure a lot of people out there are thinking, what's the difference between like medical transcription and medical coding? Because you hear about people in those programs all the time.
So medical transcription is basically the physicians or other practitioners will dictate, meaning that they'll get on a phone and record what they saw with the patient. And so the transcriptionist will basically just sit there and type out word for word, what the physicians said. So they're specialized though with the medical terminology and the lingo, and so it's not just somebody that can just transcribe anything. There's a lot of specialized terms and how they spell it and do it quickly. Medical coding, what we do is we assign code. So it's kind of like, if you haven't been to the library for a while, but with the library, you have the card catalog.
Dewey Decimal System.
Exactly, the Dewey Decimal System. And so you have a
was
section.
An English major.
Yes. So you have a section for history. You have a section for nonfiction and that type of stuff. So we have kind of they almost kind of look the same way. They're like 3-digit with a decimal and up to maybe 2 other digits. And so we have sections for eye diseases and endocrine issues and falls and injuries, external injuries like that.
Yeah, you showed me your coding book. It's like a coffee table.
Yeah, it's
not a coffee table book, mind you.
No, it's
an actual
not.
Coffee table.
Yes. It is pretty heavy, so it's pretty thick.
Yeah.
And the print's very small. So
It is. So now, I when we were talking before too, when we first were meeting in your office and talking, I was surprised at all the things that people can get done as part of home health care.
Correct. Yeah, there's a lot of people across the country don't understand how home health has developed over years, decades, and so a lot of people just think it's a nurse that goes into a person's home and just takes
A
blood
hospice
pressure.
nurse right before you die.
Correct.
Is what a lot of people think.
And that's one. Yeah, that's
Yeah.
one. But the complexity, just kind of like how the complexity in patients have been in hospitals and other facilities. Nurses are doing more and more for patients in homes. Sometimes it is just a general assessment. A lot of it has to do with teaching and training, trying to make some lifestyle changes. We also, now some nurses are actually doing like wound vacs. So it's like wounds that can't heal, and they use a special wound system management tool that they put on there, and they change this dressing every couple of days. There's also patients that in the past would have to be in the hospital because they would have these big drains,
right.
And now we can manage all those drains in the home.
Wow.
And so the complexity has just gotten a lot better. Most people don't want to spend their time in the hospital, and so they much prefer to be at home and where they can be a little bit more comfortable. And so home health provides that. And in addition to the nursing, home health provides physical therapy in home, occupational therapy, speech language pathology,
sure.
and social work. So there's quite a bit of stuff that they can provide at home. So,
and I suppose this is really important because in North Dakota we still have a lot of people very rural. So to spend a lot of time in the hospital is just not practical for them.
Correct. And there's in particular like with the rural areas and stuff, sometimes those patients, maybe they don't qualify for a nursing home because they're not sick enough, but they can't drive into town to see their physician.
Sure.
And so, if it's too much, if it's this taxing effort to come in, then the nurse can go out there. And, especially during the wintertime, you don't want somebody getting in a car and trying to drive into town where they can slip on ice and, maybe they're recovering from a hip fracture already. They don't need another hip fracture, dealing with that. So the therapists and the nurses can see them in home.
So now let me ask you this. If let's say I'm somebody who's living, 30 miles outside of town. I don't want to drive in. How would I even go about having somebody come out to my house? Do they contact the regular clinic, their hospital, doctors? Who do they even call to try to get a system like this set up?
Yeah, the referral really needs to come from the physician's office, and the physicians would know kind of who they're kind of working with. A lot of the hospital organizations have their own hospital-based agencies. Sometimes there's also private agencies, and one's not better than the other. They're all really good. Some have a little bit more services than others at times and have different areas of coverage. And so, like with St. Alexis here in town, they cover a big rural area.
Yeah.
And, I calculated one time that area that they cover in the rural area is the size of Connecticut, Rhode Island, and Delaware put together.
That ain't nothing for North Dakota.
No, it's not, And so when we talk to agencies across the country that, maybe in Connecticut, like, oh, yeah, we cover half of Connecticut. I'm like, okay.
You're like, that's 5 miles.
Yeah, exactly, and that's, for this agency, that was just, part of their territory that they covered. So it's kind of amazing across the country. And I've worked for agencies here in North Dakota and in Ohio. And, it's the models may be a little bit different, but the problems are the same, and the patients that they take care of are all the same. So
let's say I want to get into medical coding. How do I even go about that? How would somebody now is like, hey, I didn't know there's a need. I want to get into that. Right.
So right now, a lot of schools are offering medical coding programs. So there's a lot. It kind of depends on what you're kind of looking for. If you're looking for like an on-site where you kind of go there and learn, some people learn good that way. There's also online programs across the country. Some people that actually have had healthcare experience and have been in the field long enough, they actually might be able to take some of the certification test. When you're not knowing exactly some of the terminology and some of the other background, that gets a little bit more of a challenge. So usually what we recommend for people to start off is to seek out some of these programs. And there's a lot. If you look up AHIMA, which is the American Health Information Management Association, AHIMA, look up them, or AAPC. They're the two big certification organizations out there, and they can usually find somebody in your local area there that would do the teaching and training.
So maybe we have some people out there listening right now from other states and have been looking for coding jobs. Are you guys still hiring at Daymark?
We are hiring. The one challenge that we have, though, is our coders have to be also home care certified. So they might have gone through the training, got
Sure.
the RHIT training, but our coders have to be it's HCSD certified. And so we're actually working on some bridge programs right now to kind of help some of that gap so they can get certified. But it's just to kind of get them up to speed and just specifically how we code in home care versus other locations.
Okay. So then how do people get a hold of you, either to talk to you about coding, or maybe they have some questions on, how they can get some home health care for Grandpa?
So they can call our organization, 937-885-5918. For right now, they can just dial 0 and they'll give them to the operator, and from there we can kind of route them to somebody that can help answer some of the questions.
Awesome. Well, thanks for coming in today. I'm looking forward to talking to you about this a little bit more as time goes on.
Very good. Thank you, Stacey.
Thanks, Nick. And we'll be back here in just a little bit. You're listening to For the Health of It on urlradio.net.